What's going on, everyone? Welcome back to my channel. In today's video, we're looking at the single best exercise you can do to get rid of nerve pain that goes down your leg. So if you've got symptoms like that, stay tuned for today's video. So the exercise we're going to look at in today's video is a sciatic nerve mobilization. This is sometimes referred to as nerve flossing, and amongst all the exercises you can do for pain that travels down your leg, this is the one I see in patients over and over again that tends to help them the most. There's going to be two variations of this exercise. The first one is going to be less stressful, and then the second one is more stressful on the nerve. So if you're not sure where to start, just start with this first one. If you jump into the second one too early, it can flare nerve pain up in some cases. So just start with this first one and see how your body responds. For this one, I'm going to lie on my back. I'm going to use a stretch strap. This is just a tool that has little loops in it. It's great for stretching. I'll put a link in the description if you want to get one of these. You're going to hook it around your foot, and then you're going to lie back, and it's going to look almost like I'm doing a hamstring stretch. The sciatic nerve runs right through the hamstring muscles, so it's going to be similar. Now what you want to do is use your arms to bring your leg up, and just to the point where you start to feel your nerve symptoms. Don't go too far past that because you can flare the nerve up. So keep your knee straight, just go up to where you feel symptoms. And then what you're going to do here to mobilize the nerve, we're going to alternate moving our ankle and our head together. So for this one, starting out, I'm going to point my foot, and when I do that, I'm going to lift my head off the ground, and then I'm going to go the other direction, lay my head down, and pull my ankle back. So I'm just going to alternate back and forth like that. And you can kind of imagine that nerve, why this is called flossing. It's like pulling the floss back and forth through your teeth. When we do this, it pulls the nerve towards the ankle and then up towards the neck. So these mobilizations have been shown to help the nerve slide better and also to improve blood flow to the nerve, which will increase oxygen and nutrient delivery, which can reduce pain. So for this, go for 10 to 15 repetitions, and you can do it several times throughout the day. If this gets to the point where it's easy or doesn't seem to be tolerating or doesn't seem to be triggering your symptoms, then go on to the second variation. My new book is out. It's available on Amazon and Barnes & Noble. It has rehab programs with pictures of me doing the exercises for the 50 most common injuries and pain issues we see in physical therapy. Each body region has its own chapter, so if you go to the low back chapter, you'll find a nerve pain and sciatica program. The exercises I showed in today's video are part of that program. So if you'd like to have something comprehensive at home that covers all of the most common injuries and pain issues so you can do your own rehab, I will put a link for the book down in the description. This second version of the sciatic nerve mobilization is called a slump mobilization. Like I said, this one does apply more stress to the nerve, so just move on to this when you're ready, and the other one is easy and you're not maybe feeling a lot of your symptoms being triggered. So for this one, you're going to put your arms behind your back. You're going to slouch down. As we round the spine, it puts tension on the spinal cord. And then we're going to straighten the leg, which is going to put tension through the buttock region down the back of the leg. And we're going to do a similar alternating pattern with the ankle and the head. So when I point my foot, my head is going to go down. So I've got tension on the nerve here, and it's on slack down there. And then I'm going to alternate. Now I have tension on my ankle and less tension up at my neck. So I'm just going to go back and forth, mobilizing the sciatic nerve all the way up to its connection to the spinal cord. Our nervous system is one continuous network, so these types of mobilizations work by targeting the entire path of the nerve. So again, go back and forth 10 to 15 times. You can do this 4 to 5 times throughout the day, as much as it seems to help your nerve pain. All right, you guys, so that's one of the best exercises. A sciatic nerve mobilization is one of the best ones that helps with pain that's traveling down the leg. Give this a try. If you have any questions, put them down in the comments section and I'll get back to you. All right, see you in the next video. Bye.